Hey guys, welcome back to another Something in About 5 Minutes. Today we're talking anatomy of the upper airway, so let's get started. Alright, the first structure that I want you guys to be aware of on my drawing here is this large structure right here. And this is, just know, this is the nasal passageway that turns in to the nasal cavity. Okay? Now, at the back of the nasal cavity, we have this area right here. Okay? And this area is going to be called the nasopharynx. Okay? So then, if we have the nasal passageway, we must have an oral passageway as well, right? This is the mouth here, and it turns into the oral cavity. Okay? And this area right here, okay, is going to be your oropharynx. Okay, there's a Y. Now, before I move on, in between your nasal cavity and your oral cavity, you have a hard, bony-like structure. And that's right here. And that is going to be called your hard palate. Okay? Now, at the back of your hard palate, when you're touching the roof of your mouth with your tongue, it's hard until you get to the back, right? And you see this structure right here. And that structure is going to be your soft palate. Okay? And then at the very back, you have this structure right here, and that is going to be your uvula. Okay? Now, your uvula is that hangy ball thing in the back of your throat. Okay? This triggers gag reflexes and such like that. Now, inside the oral cavity, we all know we have our giant tongue, right? So this large muscle structure right here is going to be your tongue. And now I could draw in a little structure right here. Okay, that's going to be a bony mass. And that's going to be your mandible. Okay, that's a bone. I'm going to draw in another structure right here. And that's another bone called your hyoid bone. And we know that our hyoid bone is the only bone in the body that's not attached to another bone. Okay? This is your free-floating bone. Okay, so as we move down this airway structures here, we have our nasopharynx, our oropharynx, and then we get to this area right here, which is our laryngopharynx. Okay? Our laryngopharynx. Now, in the laryngopharynx, we have a bifurcation. Okay? Two tubes. This tube in the back of the throat is the esophagus. Okay? That's the food tube. And in the front here, we have our trachea. Okay, now that is our wind tube. Now remember that the trachea is actually a striated tube. Okay, so if you put during intubation, if you go through the vocal cords, you can actually feel the striations within the trachea. Now I mentioned the vocal cords because they are a very important structure at the top of the vocal cords or at the top of the trachea. And they are located right there, okay? Those are the vocal cords. Very, very important structure. Now, the last two structures that I want you guys to be aware of is, first off, is this structure right here, this little indentation, okay? This little indentation is called the vallecula. Okay? Alright, the last structure I want you guys to be aware of is this structure right here. Okay? And that is going to be the epiglottis. Okay? The epiglottis is extremely important in that it helps to protect the trachea during the action of swallowing. This is the structure we have to move to be able to intubate patients. And why I included the vallecula is that is the space inside the oral pharynx that the Mac blade actually sits in to help pull up that epiglottis. All right, guys, I think we covered all of the structures that you need to be aware of within the upper airway. Remember, the upper airway goes from the nose and the mouth to the vocal cords, and then we start talking lower airway. Thank you guys for watching today, and I will see you in the next video.